as many of you know, Gary and I started a podcast several years ago called Less Insurance Dependence, and we co-host this podcast, The Thriving Dentist Show. And we worked well together, and we have mutual clients. So we do the marketing, we make the phone ring. Gary's coaching team and Gary focuses on helping those practices improve all different pieces of their practice, including how the doctors and the team get better and better at accepting treatment. And Gary's a numbers guy. I'm sure you all know this because you're all fans of this podcast. So he measures everything. He measures all kinds of metrics. And one of those metrics he really focuses on is case acceptance or treatment acceptance. So today, Gary's going to talk about, what is a good goal, like in terms of a benchmark, and also get into lots of nitty-gritty details on how you, as a practitioner, as a practice owner, improve your treatment acceptance. So Gary, I'm really looking forward to our conversation today. And I know you're going to share a lot of the experience from your clients with our audience today.
I'm excited about this episode as well. And I want to start it off by sort of sharing with our listeners where my interest in this topic started. This goes back to the early 1980s. And some of you have heard me talk about a wonderful mentor of mine, Dr. Omer Reed. Dr. Reed is quite literally a legend in dentistry for many, many, many reasons. We lost Dr. Reed a few years ago when he passed. I believe Dr. Reed was 87 years old when he passed. But he was a tremendous influence on me, on my career, and on the dental profession. By the way, Naren, we did an interview. I did an interview with Dr. Omer Reed that is in our early episodes. I'd like to put a link to that interview in the show notes. So we'll put a link. There's an interview I did with Dr. Reed, and it's fascinating. You'll enjoy it, and he will become a mentor to you posthumously. We'll put, and if you want to find that, just go to thrivingdentist.com, click on the podcast, scroll down to this episode, and you'll see a link to that interview I did with Dr. Omer Reed. In that same show notes, as Naren mentioned, you'll find the video from Dr. Jared Johnson on the indirect pulp therapy as well. Okay, so Omer, I was working with him early on in the early 1980s, and he made a comment to me. He said, Gary, you know what? He goes, do you know most dentists are file cabinet millionaires? File cabinet millionaires. And I must have had a bewildered look on my face. Like, what? I didn't say what. I just kind of nodded. And he said, Gary, let me explain. And we have to go back and understand technology, 40 some years ago. Computers were yet to find their way in offices. By the way, Dr. Reed was one of the very first offices in the country to computerize. He did that in the early 1980s. But if you think about most offices, back in 1982, 1983, they had paper charts. They had, appointment books, actual physical analog appointment books, to make the future appointments. And they had file cabinets where they put the charts.
Right.
And so Dr. Reed must have seen a bewildered look on my face. And he said, here, let me explain. He said, dentists put their charts in a file cabinet, and the charts in the file cabinet are filled with treatment that's been recommended, but has never been scheduled. And as a result, if you add that all up, that represents, unscheduled treatment represents well over $1 million if a doctor's been in practice for any amount of time. And this was, in 1981, $82. By the way, just to put it in context, there was a book written in the early 1980s that was titled How to Achieve the $100,000 a Year Practice. So if there was a book in that title, it must have been that $100,000 a year practice was considered fantastic, right? Because there's a whole book about it. So imagine for a practice that was exceptional, that had $100,000, in revenue and collections, and they had over $1 million in unscheduled treatment plans. And that's what Dr. Reed meant when he said most dentists are file cabinet millionaires. In fact, Naren, you're not going to like this comment that he said because you own a marketing company. But Dr. Reed said, if dentists could just get their existing patients to accept their recommended treatment plan, they would never need another new patient in their practice. Now let's fast forward today. Today, you can actually find out what the amount of your unscheduled treatment plans are through your software. Dentrix, EagleSoft, Open Dental, or frankly, whatever your practice management software is, you can run an unscheduled treatment report. By the way, be sure you don't hit print accidentally when you're running that report, Naren. You know why I'm suggesting not to run print?
It's going to be like pages and pages and pages long, right?
It's going to look like the phone book. Remember when we had those phone books, Naren?
Yes, yes.
The telephone book? It's going to look like a telephone book. It's going to be hundreds and hundreds and hundreds and hundreds and hundreds of pages long. So there's the context to this discussion. Now let's kind of move down the road on this. Peter Drucker, the legendary business management consultant, famously said, "You can't manage what you can't measure. You can't manage what you can't measure." And along those lines, Doctor, how are you doing when it comes to case treatment acceptance? You present the dentistry. How do you do? What percent of your patients accept treatment? And we know by evidence of your unscheduled treatment report that many patients, have treatment. They have a need, they have a want, they have a concern, but they don't accept it. And so the question is, you can't manage it if you don't measure it. So we've got to start measuring your case acceptance. Now, or treatment acceptance. Now, I want to emphasize that measuring treatment acceptance is a very challenging polemic. It's a very challenging dynamic. And here's why. Because we know that if we're presenting dentistry that isn't needed right now, the patient doesn't necessarily accept it right away. And so somehow you have to measure your treatment acceptance over a period of time, because you have to at some point close the door, because that allows you to finally track what I presented versus what got scheduled, what I presented, which got accepted. And when I was starting to play around with this, I started to play around with some different timelines. And one of the first timelines that I experimented with was treatment acceptance this month. So in other words, patients that came in during this month, what percent of the treatment that was presented to them got scheduled? But I quickly realized that the 30-day, the monthly time limit was not realistic in any way at all. So it's not realistic because if it's something that's elective that they didn't need immediate treatment, they may be thinking about it and it may be something that they do 2 years, 3 years, 4 years later. But in order to actually figure out what your treatment acceptance percentage is, you have to have a finish line. It can't be forever, because if it's forever, Naren, we never have a way to do the tracking. Is that making sense? Naren, you're pretty good at math. Is that making sense?
Yes, Gary. Yes, I totally agree with you. I mean, I run a marketing company, and we do lots of things to test and improve, what works and what doesn't. Like, there's no way I can run my company without data, without, literally numbers that I can say, okay, last month it was this month this is this, and here is where I want to be, and this is perhaps some of the ideas that will help me get to where I want to be. Like,
well,
for example,
with that in mind, I wanted to come up with a better timeline to measure treatment acceptance. I knew it wasn't 30 days, because again, if it wasn't urgent, that might be something that happens down the road. All of our listeners have had a case. Maybe we're presenting something elective, like adult orthodontics. Maybe you do Invisalign. Maybe you do 6-month smiles. The patient's interested, but they're not ready. But they remain a patient in your practice. They come in, hopefully they have healthy gums. They come in every 6 months. But then 2 years, 3 years down the road, maybe now they're ready for that adult orthodontics. Does that make sense? No, that's just a human dynamic. Yeah.
Yes.
But in order to track this, you have to have a finish point for you to track it. So I started with 30 days, and that was way too short. That was not accurate. And then I took the pendulum and swung it the other way, and I went to 5 years. So I'm thinking, well, some of it, might have to percolate a little while. But that also wasn't realistic because it didn't allow us to track it in real time. It was too far out. And so what I settled on was a year. And for us, because it seemed to me like that was a nice balance between allowing enough time for patients to think about treatment and then enough time to where we put a finish line on it so it was more tied to real time. And so that's the timeline I'm going to suggest that we track treatment acceptance is a year from the time that it's presented. What percent gets scheduled? What percent gets scheduled?